The OnControl system offers clinicians an easy way to efficiently obtain quality aspirate and core-trafine samples. The system can be used for sample collection using a single needle or two-needle approach. This segment captures the single needle approach. Ensure proper identification of anatomical landmarks by palpating either the anterior or posterior iliac crest prior to starting this procedure. The OnControl biopsy system is indicated for use on adults for aspiration and biopsy at the anterior and/or posterior iliac crest. For pediatric patients, the OnControl system may be used for aspiration at the anterior or posterior iliac crest. Prepare the procedure site and patient according to your institutional policies. This video illustrates the use of the OnControl system, utilizing sterile procedures. Follow your institutional policies when performing procedures with the OnControl system. After preparing the patient, open the OnControl system tray. Ask an assistant to insert the power driver into the sterile sleeve and press down until you hear a click. Cover the driver with the sterile sleeve by picking up the blue end tabs and pulling straight up until the plastic sleeve is extended over the driver. Remove the paper from the tape and fold over the sleeve flap, adhering to the tape. Roll the sealed end down toward the driver and fold in the tabs to secure. Seal the driver before opening other contents of the tray to ensure sterility is maintained. To prepare the needle set, peel open the sterile pouch at the center of either end and carefully pull or drop the needle set contents onto the sterile tray. Ask an assistant to open and drop the clear plastic depth guide into the sterile tray if it's not already preloaded on the OnControl needle set used. Remove the protective sheath from the needle. Check the needle set to confirm that the stylet and cannula are well connected. Insert the needle into the black connector, pushing, not twisting, until a click is heard. If the needle hub doesn't create a click, it is not fully inserted. Slide the depth guide onto the tip of the sharp end of the needle. Use caution while placing the depth guide over the needle tip. Slide the guide until it is close to the hub of the needle as shown. Leave a few millimeters of space between the hub and depth guide. Prepare the procedure site according to institutional policy and procedure. Make a 3 millimeter incision in the skin. Insert the OnControl needle through the soft tissue to the outer cortex. Confirm angle and location. At any time you are powering the driver, do not bring spinning components in contact with gloves, gauze, or sterile drapes, or they may become wrapped around the shaft of the needle. Once the cortical location and angle is confirmed, advance the needle through the cortex by squeezing the trigger and applying steady, light pressure downward on the driver. When you reach the medullary space, the needle will give or drop, and the tone of the driver also changes audibly. The length of time required to penetrate the cortex will depend on patient anatomy. When in the medullary space, disconnect the driver by pulling up on the collar of the connector and lifting the driver up and off of the needle hub. Place the power driver on the sterile field for later use. Stabilize the needle hub and unscrew the stylet by twisting counterclockwise and pulling up and out of the cannula. Place stylet on a secure, sterile field. To obtain an aspirate, connect a sterile syringe to the needle hub and proceed with aspiration according to institutional policy and procedures. To capture a biopsy specimen, reattach the driver to the needle hub, pressing down until you hear the click. Move the depth guide down the needle to determine the desired length of the specimen. Each set of marks is 1 centimeter from the next. Engage the trigger on the power driver and advance the needle quickly down to the level of the depth guide and then pull up and out of the patient in one swift, smooth motion, typically over 1 to 2 seconds. Performing the procedure more slowly may result in capture of a shorter core biopsy. To expel the sample from the inner cannula, insert the sharp end of the biopsy needle into the large end of the alignment guide. Disconnect the needle from the driver by pushing the ribbed collar toward the power driver to disconnect. Insert the blunt end of the ejector rod into the alignment guide. Tap the rounded end of the ejector rod using the base of your palm until you feel the core inside release. For very dense, hard bone patients, you may need to tap several times with greater force to feel the release of the core inside the cannula. Gently push the ejector rod through the needle cannula, expelling the medullary tissue core sample out of the hub. Hold the hub up off any solid surface to avoid damaging the fragile medullary specimen as it's ejected. Ejecting the core onto an absorbent surface may prevent splashing fluid in front of the core, inside the cannula. Do not insert the ejector rod into the hub end of the needle cannula, as this may affect the specimen quality. Thank you for using the OnControl bone biopsy system. For more information, go to vitacare.com.